Very early onset schizophrenia is very, very rare, but there is a child who was diagnosed at the age of 6 named Janie, and you can actually find her story online, and it's called Born with Schizophrenia. If you have ever met anyone with schizophrenia or any other type of mental illness, then you understand what their struggle is and how difficult it is to go through life day by day. But if you have never met someone suffering from schizophrenia, then I'm going to be here to educate you and inform you on this chronic mental illness. So I've worked in the mental health field for 7 years. I have worked in group homes and treatment facilities for people who are suffering from substance abuse. I have worked with the developmental disabled, along with people who suffer from mental illness. I currently work with 5 mentally ill women in a group home. And I also per diem with youth and adolescents who suffer from mental illness and substance abuse, which is called dual diagnosis. I also currently per diem with the DOC, which is the Department of Correctional Facilities, with people who suffer from mental illness, and I also per diem at the shelter. So the warning signs of schizophrenia in youth and how you can tell if you need to get a child professional help, the different treatment plans and therapy the child needs to work with in order to maintain their baseline. Now, a baseline is that child's norm. And the medications that these children will need to take on a daily basis. So, first I want to review the warning signs. They have language delays, late or unusual crawling, late walking, abnormal motor skills, abnormal behavior such as any type of negative thinking, trying to hurt themselves but not really understanding why they're hurting themselves. They will have hallucinations, delusions, disorganized thinking, disorganized motor skills, and that is caused by because schizophrenia is a brain disorder as well as being a mental illness. So some of these signs and symptoms are also in common with developmental disorders such as autism. So it's very difficult when diagnosing to distinguish between the two. So ruling out all these developmental disorders is the first step from a child to be diagnosed with schizophrenia. So now onto the treatment plans and therapy. There's different types of therapy. There's CBT, which is cognitive behavioral therapy, and that was originally developed to provide additional treatment for residual symptoms, and drawing on the principles of intervention strategies. So they also use that with anxiety and depression. Being able to find a therapist who you can communicate with, you can trust. Building rapport with someone is a very, very great thing to have, especially with a client who usually won't trust many people or trust no one. Being able to cope and being able to speak about your feelings, because stress is one of the biggest things that can cause a psychosis and can make schizophrenia, the symptoms of it worse. And a psychosis would be psychosis is an episode where the client is no longer there. And I've dealt with a lot of episodes from clients who suffer from schizophrenia, and I will tell you firsthand, it's a very scary, difficult thing to deal with. So a lot of therapies that are really great is art therapy. Kids love the art therapy. You give them a piece of paper and some coloring, pens and crayons, and it's so I wish I had a picture, but usually these children, you tell them, go ahead, draw whatever, and they will draw out their feelings. Music therapy is also really great for children who are suffering from mental illness or schizophrenia. So now we're going to talk about the different medications and their side effects. So there are typical antipsychotics and atypical antipsychotics. So typical antipsychotics have a lot of terrible symptoms, especially when you have long time use for them. You have no motivation, you are always tired, you feel like you're sedated, you end up gaining a lot of weight, you are always nervous, and you always have, most clients have a tic, so they will kind of twitch their body or have rapid eye movement. So in the recent years, newer drugs for schizophrenia have become available, and these are atypical antipsychotic medications. They have very few side effects and are recommended for children who are suffering from schizophrenia. So in conclusion, these are the warning signs, the treatment plans, and the medications used to help with schizophrenia. There are no cures for this illness, and there's still so much more research that needs to be done to help figure out what causes this, because people still aren't sure what causes this. So I just want to show you guys a quick picture. And these are the different studies in a brain scan and the brain structure of people with schizophrenia. So this is an adult brain with a normal brain. And this is a person suffering from schizophrenia. Now, as you can tell, their frontal lobe, which is number 1, are completely different. Number 2, there's much more gray matter. And number 3, there's a lot more pockets that are in the brain. And that's unfortunately how a lot of diagnoses come through, is with an MRI. So schizophrenia is a very challenging disorder, and it makes it difficult to distinguish what's real and unreal. It's hard for you to think clearly. You can't manage your emotions. It's difficult for you to relate to others and function normally. But that doesn't mean there isn't hope. And schizophrenia can be a very successful managed mental illness. The first step is to identify the signs and symptoms. The second step is to seek help. Talk to someone, tell someone how you're feeling, and with the right treatment, support, and medication, a person with schizophrenia can lead a very, very happy, fulfilled life. Thanks for listening.